Hi, my name is Elsa. I am an EHS patient, electric hypersensitivity. EHS patients are often tremendously sensitive to EMF, electric magnetic fields. So that means all technological devices from your kitchen to your office and wireless devices affect our neurological systems, and it can give rise to various conditions. For instance, when I was since 15 years of age, I was diagnosed with various autoimmune illnesses such as fibromyalgia, arthritis, asthma, and in my early 30s even with cancer. We often also suffer from multiple chemical sensitivities and other various complexities. But EHS runs much deeper than merely a medical condition. It's also a social problem whereby most public places aren't very accessible to us, and in that also not the medical help that we need. If I want to leave this Faraday shielding cage that I spent most of my time in, I have to wear shielding material like this and cover my head also, as you can see in the photo at the top, so that I do not express various neurological problems such as confusion, dementia, seizures, and various other conditions. So we came up with a plan where we want to actually make life, first of all, a bit more accessible to me so that I can get the medical help that I need. And that means placing the Faraday shielding cage on wheels. So it's very exciting. I've done a whole writing piece at the bottom. I've tried to keep it short, but because the condition is rather complex, it's not that easy to keep it just in a few sentences. I've explained how we can create a solar panel van where we can block some of we can control the electric magnetic fields that comes in. This would make a hospital accessible to me because I can literally get my operation and be admitted to my van. But it can make life even more accessible to the point where I hope, with some of the ones that you give to me, to make a documentary about this condition. Because the longer I had this condition, the more it occurred to me that it's a rather ill understood condition, currently in research phase. For years it's been seen as a psychiatric or a psychological condition, and thankfully neuroscientists has done a case study now where they viewed the brain of an EHS patient in a functional MRI, where they viewed and saw, well, it's interesting, because there's similar problems in every single EHS patient's brain. And it included things like cytotoxicity, mast cell disease, and concussion. And I've decided to include the case studies link in the writing at the bottom that you can view for yourself, the various MRI pictures and the writing and discussion in it. It's just fascinating how they're now discovering more and more information on this. And that would also mean more and more help for the patients. Yes, so and I think in that regard, the documentary will help patients and professionals alike that works with the patients and scientists, because I will not only film some of my own journey that I have to walk every day, but also various opinions from various specialists to integrate the viewpoints. And I really hope this can help people. There was times that I was bedridden, barely able to walk, and just changes in my lifestyle has made it possible for me to speak to you in a very normal way, at least while I'm in my cage or my clothes. And I think that's also worth sharing, especially with the patient, but also the professional, understanding how the smallest of changes can make a big difference in our lives. So at the bottom you can read exactly what we are hoping to, I've outlined exactly what we hope to achieve with the funds and the sponsorship that you provide. And I want to thank you for viewing this video, and if you decide to contribute, also thank you so much for being part of hopefully a great transformation and help for myself as well as hopefully some other people also. Have a lovely day. Thank you. Goodbye.